Something was not right with Jason when he limped into our small family medicine clinic. He's a 52-year-old construction company owner with a lot of medical conditions, hypertension, hyperlipidemia, insomnia, depression, anxiety, and chronic low back pain. But on this occasion, something was different. He hobbled up onto the exam table, lifted up his pant leg, and said, "My knee is killing me." Now, when I saw this red hot swollen joint, the first thing that comes to my mind is not what it is, but where it is. This knee does not belong in my office. I'm going to need some serious help. Now, like what Dr. Edwards said, I come from a long line of family physicians. They seem to get better looking as they kind of progress through the ages. And it is true, my middle name is Michael, and I didn't know what my initials meant for a long time, and my dad just kept saying, "Ask your mom." That didn't really work out very well. But I grew up hearing all sorts of very interesting stories. Many of these stories came from my grandfather, actually, while he practiced in Kanab, Utah, which is a small southern rural Utah town. I just remember particularly one story, and it kind of fits with what we just watched with Dr. John Edwards, about kind of a rough as tough as nails rancher that fell off his horse and presented with signs and symptoms significant for severe brain swelling. And so my grandpa had to call the neurosurgeon on call, had the nurse hold the phone to his ear. This is the 1970s, granted. Hold the phone to his ear as he was walked through how to perform a burr hole operation to help stabilize the patient. And the patient survived. He then, I remember another story, actually. He delivered a newborn and immediately had to call the neonatologist because he recognized that the intestines were not where they were supposed to be for this newborn, and was walked through how to stabilize this newborn. And it was actually to just kind of tuck the intestines back into the abdominal cavity. And I actually researched this, and this is actually not the standard of care right now, but it was the 1970s and the baby lived, and so that's all that mattered. One of my favorite stories, though, was actually the day after my grandfather passed away. He passed away quite suddenly, and my dad had to actually cover for him because he was practicing full time and had patients on the schedule the next day. An elderly gentleman walked into the clinic and started weeping when he found out that my grandpa had died. He lifted up his shirt sleeve, revealing this tattoo. And he said, quote, "Dr. Sundwall saved my life. A few years back, he diagnosed me with a heart attack, consulted with Dr. O'Neill, the cardiologist, and got me fixed before I had permanent damage. These doctors are my heroes." Now, just really quickly, if any of us get our name put on a patient as a tattoo, we're done, right? We have made it. We retire. It's over. We're at the highest we could possibly get. I'm really amazed at a lot of these stories. I think back on them and I'm like, wow, that was absolutely incredible. But one thing I really recognized and what I loved about them is how much my grandfather actually relied on expert care. He relied on the specialists to help him. And he would always talk about how much he appreciated them and how willing they were to help. Together, they had kind of formed this common goal to help the patient, a physician-to-physician relationship that was built on trust and respect. And I just loved hearing those stories. And after I went through medical school and residency, and even as an attending, I was kind of thinking, I'm going to develop these kind of relationships and develop that kind of respect with the interspecialty complexity of medicine. Unfortunately, that may have not been the exact same experience that my grandpa probably went through. Frankly, I learned a day not consulting specialists was usually a day way better than when I had to. My primary care friends and I, both older and younger, have often, unfortunately, commiserated over our experiences with consulting with specialists and even fellow family physicians. we agreed it was quite common to get some ridicule during the consult to our face, or even worse, to the patient directly. We made a list of quotes, actually, other physicians allegedly said to our patients. Some of them include, "You don't need all this workup. You don't need this image. Why did they do that? They should have done this. You should have gotten this surgery. You should have not gotten this surgery." Or my favorite, "Why are you even here? I don't need to see you. Your PCP wasted your time." Now, we concluded these responses really helped no one, most importantly, the patient. Now, we all wanted to be taught and improved, but being spoken down to or ridiculed was not the most favorite part. I know we have talked a lot about burnout, and I don't want to touch on it more than we have had to, but there was a recent Medscape survey that came out that said that a majority of physicians surveyed stated that the number one cause of their burnout, the number one factor, was poor respect from fellow colleagues. And more importantly for me, a crucial outcome from poor camaraderie between physicians is the negative impact it has on our patients. I think it delays care, it leads to more patient frustration, and really just fosters this general mistrust in the medical system at large. But there's a lot of hope. A fellow friend and family physician, Dr. Curtis, told of an experience which was awesome and one I think about regularly. He sent a patient to cardiology due to significant coronary artery disease. When the patient went, the cardiologist actually spoke very highly of my friend, Dr. Curtis. He said that the patient got great workup, great care, and was ready to go and ready to meet the demands of what cardiology wanted to do. Now, when the patient came back to Dr. Curtis and relayed this experience, Dr. Curtis realized three things. He noticed, one, the patient was more compliant and more satisfied with the care they received. My friend wanted to be a better physician and practice the best standard of care and practice the best medicine. And three, Dr. Curtis would always refer to that specialist. Now, to finally conclude Jason's story, I know I needed help, and the standard of care for him, honestly, was sending him to the emergency room for the concern of a septic joint. So I begged and pleaded and really was just, please go to the hospital, but he wouldn't. Mostly because of the fear of, one, cost of going to the ER, and secondly, he didn't want his life disrupted. And so I still didn't want to make him leave. I needed to do the right thing, but that next best thing, because he wasn't going to the emergency room, was to consult the specialist. Man, I'm making you guys sound really evil. I don't really mean to do this, but it wasn't even any specialist. It was orthopedics. All right, it was orthopedics. But I had to do what was best for the patient. And so I called. It was answered by the orthopedic surgeon, who was very well respected, extremely busy in the community, and gave the presentation. The patient, was partially expecting some degrading short response of, you should just do this and it's okay. But what I got was, and I want to quote this, "That sounds tough. I'd be more than happy to help. I'll make sure to get that patient seen as fast as possible. If you can get this workup done in the meantime, that would be great. Thank you, and call anytime." I was so taken off guard by this response. I honestly, when he hung up, I wanted to call them again and just to confirm what I just heard. I cannot believe it happened, but wow, what a relief. Jason gratefully agreed with the plan. He saw ortho quickly, got surgery right away due to a septic joint, and is now so compliant with the care that he is receiving that honestly his chronic medical conditions are slowly diminishing, which is awesome. And I found myself just having this desire and burning to become a better physician. And I will tell you that orthopedic surgeon has probably received most, if not all, my referrals. I want to give this a quote. Oh, that's how I felt. I was lifted up. "Mutual respect and courtesy should be non-negotiable, fostering an environment where collaboration and professionalism are paramount. As we navigate these changes, meaning the changes in medicine, it's crucial to remember and revive the foundational principles of respect and support within our medical community." Now, in conclusion, I would like to invite us to continue to be cordial and approachable if a fellow colleague is asking for help. I invite us to continue to speak highly of one another in front of patients whom we are jointly caring for. And I invite us to continue to teach one another, not to grade, but to build, like we are doing this weekend. I have felt my burnout just go way down after this conference because I'm collaborating and being with all of you. I do know if we do this, I think we'll become better, stronger physicians and providers. We'll be more motivated, stronger, and I do feel that patients will be more compliant and more satisfied with their care. And maybe, just maybe, a patient will tattoo our names on their arm. Thank you.